Hello, viewers. You're welcome to our enlightenment program on brain and spine health. We started in this series of talks that focuses on issues that affects the brain and the spinal cord. And we began with headache, in which we saw that there was primary headache, which had no underlying causes, and we also mentioned secondary headaches, which are conditions, types of headaches that have underlying causes. And in our last video, we began to talk on some of those causes of secondary headaches, which we gave an overview of brain tumors. And today we are going to focus on a particular type of brain tumor, which is common, and that is the pituitary tumor. Pituitary gland is a very important gland in the body. It is called a master gland because all of the hormones are chemical substances produced by glands in the body with for the purpose of helping the body function well. So those hormones, those chemicals, when they are either produced excessively or they are underproduced, they cause the body to malfunction. And the master gland that causes this secretion is the pituitary gland. It is a very small gland, just slightly larger than a peanut, and is located in the middle of the brain, somewhere there, right inside. It usually can undergo changes that leads to excessive production of certain cell lines, and that gives rise to a brain tumor. There are different types of pituitary tumors. They are the functional type. Functional type means that those ones produce hormones in excess quantity. And there are the non-functional types, which only grow in size and cause symptoms as they grow larger and larger and compress important structures in the brain. So today we are going to look at one of the functional type, which is very important, and that is the prolactinomas. Remember, I said that pituitary gland produces hormones, and these hormones help the body function. So one of the hormones that it produces is prolactin. And prolactin is the hormone that helps a mother to produce milk, which the baby breastfeeds. So when there is a tumor that causes the excessive production of this hormone, then it leads to production of milk when somebody is not actually breastfeeding. And so firstly, let's consider what is the burden of this disease. Pituitary tumors account for between 14.4 to 22.2% of the population in studies that involve autopsy and radiological studies. In other words, in the entire population, if everybody is studied, 1 in 5 persons would have pituitary tumors. But the fact is that most of them do not manifest with symptoms. Only about 1 in 1,000 tend to manifest with symptoms. Those are the ones that present in the hospital for treatment. So what are the risk factors involved in this pituitary tumors? The risk factors include, first of all, genetic predisposition. There are some people who tend to have a condition called MENS 1, which is multiple endocrine neoplasia, the type 1. These people who have these inherited genetic problems tend to have the tendency to develop this tumor. Also, it's commoner in females and in those between ages 40 and 60 years. So it's not seen in children. It's extremely rare in children, except the microtype. So these hormones that they produce, we're talking about prolactinoma in this instance, can cause a person who is not breastfeeding to have breast milk. That's one of the symptoms. So if you notice that when you either milk your nipple and compress it, and then it produces milk, or it just drips milk when you are either a man or a woman who is not breastfeeding, that may be an early symptom to show that you have this tumor. And sometimes in females, it can cause menstrual irregularity. And because of that, it also causes the females not to ovulate as they ought to. And that leads to infertility. In males, it can cause loss of libido, can cause the male breast to enlarge, and it can also cause milk to drop from a male's breast. So if you notice any of these symptoms, then you must know that you may be having this tumor. Sometimes it grows to a large size and begin to cause symptoms that result from its large size, compressing important structures in the body. So if you notice that your vision is failing, you cannot see clearly, some parts of your vision is darkened, you see a doctor, eye doctor, and your eyes are relatively normal, or they may find some abnormality, that may point to the fact that there is something growing in your pituitary gland. Also, it can cause weakness of muscles of the face, of the eye movement, and sometimes it can even cause the hormones to be underproduced. And so that patient may present with symptoms of pituitary hormones underproduction. They can cause headache, like we mentioned, one of the causes of secondary headache, and other manifestations which we won't go into details. But we're talking about prolactinoma in this instance. The good news is that if you have symptoms like that, which you can see a doctor, who will take a detailed medical history and will examine you appropriately and do some important investigations that will guide the diagnosis, including a scan of your brain. And usually, if the scan is done and it shows that you have this tumor, the good news is that it's a tumor that can be treated here in Akwa Ibom State, in Uyo, also in many parts in Nigeria. So it's something that it's not a spiritual attack, it's not a spell that has been cast on you, it's a treatable disease. And there are medications that can be given also to treat this particular condition called prolactinoma. And if surgery is required in some instances, then the good news is that surgery can be done here in Uyo, in Akwa Ibom State, and in many parts of Nigeria. So the tumor can be removed through the nostrils without having to open your head, and the surgery can be done successfully. So if you have any of these symptoms, just see your doctor, who will refer you to a neurosurgeon or a neurologist, or eventually we get you to see a neurosurgeon who will manage the problem. So don't live with something that is treatable. Life can be better than that. So I am your doctor that enlightens you on brain and spine health. Thank you for listening, and you can share this video so that others can get enlightened. And look out into this space for further enlightenment. Thank you.